Have you ever wondered why 47.6% of women may never get pregnant after having their fibroids removed surgically? The process of removing fibroids from the uterus via surgery is called a myomectomy. In this video, I will be revealing to you 5 reasons why you may not be able to get pregnant after having a myomectomy, the tests you have to do to make sure you can actually get pregnant, and how they will increase your chances of conception. And it's not the reasons you think. Make sure to watch to the end because the last one is the most important. But first, let me tell you what will happen if you don't watch to the end of this video. You will not know how to check the state of your ovarian reserve. You will not know why you have not been able to conceive for the past 6 to 8 months after having a myomectomy. You will not know if the levels of the hormones that are crucial to boosting your pregnancy chances are high, low, or normal. You wouldn't know if you've had an increased risk of an ectopic pregnancy or miscarriages. You definitely will not know if you have a very low response to fertility treatments. So a few months back, I had a patient who had a myomectomy done in her previous hospital, and she was eager to start having kids. But after 8 months of trying and consultations that led nowhere, she landed at our facility. Let's call her Jane. So Jane is a 37-year-old career woman who had a myomectomy done but still couldn't conceive. I asked her if she had done any tests after the myomectomy. She said just the scan and regular checkup. I then proceeded to explain to her that she was going to need to do a certain procedure. And in this procedure, a doctor is going to ask her to lie down on an examination table, and a tube called a catheter will be inserted into her vagina. Then a special dye will be injected through this tube into her uterus. The doctor will also use an X-ray to take pictures of the uterus as the dye fills them up. Once the dye cannot get to the fallopian tube, it means that your tubes are blocked and they will not show up on the X-ray. This procedure is called a hysterosalpingogram, which makes our first reason blocked fallopian tubes. So doctor, why would my tubes be blocked when I just had a myomectomy? You know how when you have a fall and scrape your knee, then as your knee heals up, it leaves a scar? Well, the same thing happens in surgery. Trauma or injury to the endometrium can cause scarring as it heals up. In surgery, these scar tissues are called surgical adhesions or synechia. After a myomectomy, these adhesions can occur in the fallopian tubes, blocking them and drastically reducing any chances of sperm swimming up to fertilize your egg. The condition that occurs when the fallopian tubes are blocked by these adhesions is called Asherman syndrome. Asherman syndrome was named after an Israeli gynecologist, Joseph Asherman, who first described it in 1948. Some other causes of Asherman syndrome include menstrual irregularities, having a previous cesarean section, dilatation and curettage, also known as D&C, or getting an abortion, infections like pelvic inflammatory disease or tuberculosis. So, I continue to explain to Jane how doing an HSG after a myomectomy would help to detect any blockages or damage to the fallopian tube. It would also detect if any abnormalities like polyps would obstruct implantation, and that she would also know if she was at an increased risk of an ectopic pregnancy or a miscarriage. As you can imagine, Jane was already experiencing some mixed emotions. After I finished explaining the need to do an HSG, she then asked if there are any other reasons that could be causing her not to get pregnant. I asked her if her previous doctor ever talked to her about her ovarian reserve, and not surprisingly, she said no. So your ovarian reserve simply means the number of eggs remaining in your ovaries. And just a little side note, the older a woman gets, the fewer eggs in her ovaries. Now, inside your ovaries are tiny fluid-filled sacs called follicles. Each of these follicles contains an immature egg, and several of these follicles grow at the beginning of each menstrual cycle, but only one usually matures and releases an egg. The follicles that contain the immature eggs are called antral follicles, and the process of counting those follicles is called the antral follicle count. This antral follicle count is important because it shows the number of eggs available in a woman's ovary. A higher AFC count means a larger reserve, and a lower AFC count means a smaller reserve. So she asked, how are the follicles counted? Your antral follicles are counted through a transvaginal ultrasound. This is a painless procedure where a wand is inserted into the vagina to visualize the ovaries. They count the number of follicles in both ovaries. And this test is usually done during the early days of your menstrual cycle, typically between days 2 to 5. Jane asked if it is only women who have done myomectomies that need to do this test, and the answer is no. Women considering family planning can use AFC to get a general idea of their fertile window. Women undergoing fertility evaluation or considering fertility treatments like IVF can also get an AFC done. AFCs can be helpful for women with a history of irregular periods or PCOS, which is polycystic ovarian syndrome. Jane was feeling a bit down, as it seemed this info was a bit overwhelming for her, as this was the first time she had heard some of these terms, so I had to do some counseling before continuing with the consultation. So, certain hormones are involved in the whole conception process. One of these hormones is responsible for stimulating the antral follicles that contain those tiny immature eggs to grow. During ovulation, one follicle becomes dominant amongst the other follicles and releases a mature egg around the middle of your cycle. The hormone that stimulates the follicles is called the follicle stimulating hormone. This hormone also assists in the selection process of which eggs becomes dominant and is released for fertilization. So why do you need to do an FSH test after a myomectomy? You should do this test to determine if you have a normal level of FSH, which ensures smooth egg development, estrogen production, and ovulation. We all know without ovulation there is no conception, which makes our third reason abnormal levels of follicle stimulating hormone. If you have high levels of FSH, this may indicate a decrease in your ovarian reserve. Your FSH levels naturally decline as you get older. High FSH levels might make ovulation less likely or irregular. Low FSH levels are less common, but can occur with hormonal imbalances or pituitary gland problems, and they might also delay puberty and prevent ovulation. The women that might need to get FSH levels checked are women with irregular or absent periods, women with difficulty getting pregnant, women undergoing fertility evaluation, women experiencing menopausal symptoms, women who just had a myomectomy. So I looked at Jane and asked, "How are you doing? Do you want me to go on?" And she just looked at me with a little hint of anger in her eyes and she said, "Yes, please." While still on the topic of hormones, I asked Jane if she knew what estrogen was. And she said, "It's a hormone that all women have," which is actually quite true. But did you know that estrogen has 3 main components? And those 3 main components are estrone, estriol, and estradiol. One of these 3 components is the main estrogen hormone that regulates the female reproductive cycle. It helps with the development of eggs in the follicles. It also helps in thickening the uterine lining for pregnancy. It is also responsible for the growth of breasts, widening of hips, and development of other female secondary sexual characteristics. It promotes bone growth and density throughout life, which is why during menopause, bone density becomes a problem because of the decrease in the production of this hormone. And it is also more abundant during your childbearing years. And the hormone is estradiol or E2. So, making our 4th reason abnormal levels of estradiol. Now, why do your estradiol levels matter? Normal estradiol levels ensure smooth functioning of your reproductive system and contribute to your overall well-being. High levels of estradiol can lead to irregular periods, increased risk of blood clots, and endometrial hyperplasia, which is the thickening of the uterine lining. After menopause, low estradiol is responsible for hot flashes, irritability, vaginal dryness, and an increased risk of osteoporosis. Who might need to get their estradiol levels checked? Women with irregular periods, women experiencing menopausal symptoms, women with concerns about fertility, women taking medications that might affect estradiol levels like birth control pills and steroids, some antibiotics like ampicillin and tetracycline, and women who just had a myomectomy. By this time, Jane had reached a point of relief. She was just happy that she had all this information. And in all this, there is also another hormone that is important to your conception journey. In males, this hormone suppresses development of female internal organs, and in young growing females, it plays just a minor role. But in adult females, this hormone is produced by the growing antral follicles in the ovaries. These follicles are the tiny sacs that hold your eggs. When you have higher levels of this hormone, it indicates that you have a larger pool of eggs. This hormone is also now the main diagnostic test for women suffering from PCOS, and it is called the anti-Mullerian hormone or Mullerian inhibiting hormone. What does your anti-Mullerian hormone have to do with conception? Now, AMH plays a crucial role in conception because it shows how many eggs are also left in your ovarian reserve. It can determine how well your ovaries respond to IVF. AMH can be used to monitor PCOS because the hormone is always elevated in women with PCOS and can help to diagnose and monitor the condition. AMH levels can help your doctor determine the best fertility treatment for you, such as IVF or egg donation. It also indicates the presence and growth of follicles that contain eggs. Jane thanked me and said she would come back with the results after she had done the tests. I'm proud to tell you that Jane is now heavily pregnant, and also she wasn't the one with the reproductive issues, if you know what I mean. We all know nutrition is a big part of how fibroids appear, feed and grow, and most of you have no idea what to eat if you have fibroids to bring you relief. So watch this video here to find out the food groups to eat if you have fibroids.